World Health Organization suggests the use of HB cutoff levels of less than 2 standard deviation from the mean population. The cutoff for the age group of 6 to 5 years are anemia is defined as less than 11 grams, and for 5 to 11 years of less than 11.5, and for 12 to 14 years of less than 12 grams. And MCB is taken for iron deficiency anemia if the child is less than 2 years of less than 70, if the child is 2 to 10 years then 70 plus age, and if the child is beyond 10 years then less than 80. The macrocytosis is taken as 2 to 10 years, 84 plus 0.6 into age, and if the child is more than 10 years then more than 90. The oral formulation present are ferrous. We know that ferrous is better absorbed than the ferric. Ferrous sulfate is available, ferrous fumarate is available, iron polymaltose complex, and the iron amino acid. The duration is 2 to 3 months after the HB normalizes. The HB rise is 0.25 to 0.4 per day, and the hematocrit rise is 1% per day for the first 7 to 10 days. The response, we assess the clinical response as decrease in irritability, lethargy, and well-being of the child. The appetite returns to normal within 24 hours. The reticulocytosis is seen within 5 to 10 days, and we ask the child to follow up at 2 to 4 week intervals, mostly at 14 days. And the HB commonly rises by 1 gram per deciliter in the first 14 days. So some of the IV preparations are either sucrose, ferrous gluconate, and iron dextrose. The iron sucrose is better absorbed, and ferrous carboxymaltose is also available. The dose of it is body weight into ideal hemoglobin minus desired. Now talking about the non-responders, the definition of non-responders is absence of hemoglobin rise of 1 gram per deciliter after 2 weeks of daily iron therapy. For lack of this, which is considered a lack of response. The causes can be absorption disorder, GI bleeding, celiac disease, and anemia of chronic disease. So the diagnosis is by MCV, peripheral smear, and the lab. Talking about the vitamin B12, the diagnosis of vitamin B12 is done by MCV level, peripheral smear, and serum folate level, red blood cells folate assay, serum vitamin B12 assay. The MCV is the screening test. The peripheral smear shows macrocyte or macroovulocyte. The serum folate, normal serum folate is from 6 to 20, and some recommendations take it as 4 nanogram per milliliter. The red blood cell folate assay less than 100 nanogram per milliliter is taken as diagnostic, and more than 300 is taken as normal. Serum vitamin B12 assay 200 to 300 picograms per milliliter is borderline. In this treatment there are 2 therapies. One can be oral therapy, and one can be the parenteral therapy. So vitamin B12 should be started in the initial 10 to 14 days, followed by folic acid if required. The oral therapy is given as 500 micrograms daily in the infant, and 1000 micrograms in case of the older children. In case of older children daily, it has to be given daily. And the injectable therapy, it is started as for initial 2 to 3 days as 25 micrograms of vitamin B12 IM injection or deep subcutaneous.